I was in a hospital one time and I was looking around. My daughter was actually in there. She had HUS, and so it was a little bit of a concern because she had a kidney infection. And so I was looking around the hospital and I was thinking, how do they keep track of what's going on? How do they have an intuition into what's happening in the community and what's happening to individual patients? Our system, Epicenter, works by connecting healthcare providers to public health departments. So what we do is we collect all the data from a hospital and connect all the hospitals in a region, get real-time data from them, and understand what's happening. So why is someone going to the hospital today? Is it a respiratory problem? Is it sort of a stomach disease? It's something like that. And what we're able to show is how it changes sort of moment by moment. We're able to give insight into emergency room physicians. Before they would have a system like ours in place, they would have to be on the phone talking to someone. So someone in the emergency department would have to be talking to other people. Maybe it was an EMT dispatcher or something like that. But what we can do is provide them with a regional picture of what's happening. So are we seeing an influx of the flu? Are we seeing the influx of any disease so much that we need to increase staffing, that we need to start diverging people from one location to another? So we're able to help on that level on a day in and day out basis. The other thing that we've been able to do is much subtler. When you look at something like Hurricane Sandy, prior to having our system in place, something like Hurricane Sandy would occur. They would have no idea in a moment-by-moment basis how many people are going to an emergency department. So what we're trying to do is look at ways that we can take the data that we're already getting, and instead of just looking at it moment by moment, looking at it long-term and saying, can we track and see what difference is in the way this person was treated and what the outcomes were? Because it's of interest to public health, it's of interest to the hospitals, and it's of interest to the insurers as well.